do the second portion of the head to toe assessment. So to start out, we're just going to assess the lymph nodes here. So I'm just going to palpate your lymph nodes, feeling first for the occipital, and then the postauricular, preauricular, parotid, tonsillar, submandibular, submental. We have the anterior cervical chain, the posterior cervical chain. Turn your head. Deep cervical chain, and then the supraclavicular. All right, the lymph nodes that I palpated were symmetrical, they were movable, they were small. Any pain or tenderness with that?
No.
Okay, so we're gonna move on to the thorax and the lungs. So first, I'm just inspecting the symmetry. Appears symmetrical, and then I would count for 60 seconds. Respiration rate, we'll say 18, and then also make note of respiratory, making note of any like respiratory issues for breathing, just from inspecting. And I don't see any, there's no distress, breathing is relaxed, I don't see any issues. And then assessing for lateral versus AP diameter. Lateral is wider, which is a normal finding in adults. Then we're going to move on to tactile primitive. So I'm just going to use the heels of my hands, and I want you to say 99 over and over again.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, you can stop. So vibrations were heard evenly throughout. I didn't notice any areas of dullness. So we're going to do percussion. We're just making note of resonance. Any type of dullness could indicate consolidation. All right, so resonance was heard throughout. So we're going to move on to auscultation. So you can just breathe in. No adventitious breath sounds were heard. Lungs were clear throughout bilaterally. So we're done with the anterior portion. So we're going to move to the posterior portion. Once again, assessing for symmetry. I don't see any deformity. Chest is symmetric. Then we're going to do tactile fremitus again. Let's bow our hand and say 99.
99, 99, 99, 99, 99, 99, 99.
All right, you can stop saying it now. Vibration was felt evenly bilaterally. So now we're going to test for chest wall expansion. So I'm going to start at C7, count down to T10. Place my hands here. Maybe take a deep breath, and out, in, and out. Okay, chest wall expanded evenly on both sides. So we're gonna do percussion for resonance. Once again, using the ladder method. Resonance is heard throughout. We're going to percuss the CVA. Any pain or tenderness with that?
No.
Any pain or tenderness of that could indicate polynephritis or a kidney infection. Next, we're going to auscultate. So just take a deep breath in. All right, and then I want you to say E, E, E.
E, 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 E.
All right, you can stop saying that now. No hanging A's were noted, which could be indicative of consolidation. So I'm gonna come back around to the front here. We're going to assess your cardiovascular system. First I'm just going to feel on the right side for your carotid. Okay. And then we're gonna feel bilaterally for your brachial. And then radial pulses. And then I'm gonna feel the posterior tibial. And dorsal pedal, excuse me. All right, all were 2+. Was just a brisk tapping, which is a normal finding, appropriate finding. So now I'm gonna have you lay flat there, and we're going to move on to cardiovascular. So first I'm going to use the pads of my fingers, and we're going to feel for heaves and lifts. Alright, and I'm going to use the heel of my hand, we're going to feel for thrills. Alright. None were noted, which is a appropriate finding. Then I'm going to auscultate in the 5 areas using the diaphragm of the stethoscope. So we're going to start on the second intercostal space, right sternal border, and this is aortic. Moving over to the left side, second intercostal space, pulmonic. Third intercostal space is herbs. Fourth is tricuspid. Go down to the 5th intercostal space is, and you go slightly towards the midclavicular line is the mitral. And then below the nipple on the midclavicular line, 5th intercostal space is the apex. While I'm at the apex, I would count for 30 seconds, or excuse me, 60 seconds, and count the apical heart rate. Also making note that S1 is louder at the apex and S2 is louder at the base. Turn the stethoscope to the bell side and listen at herbs point, tricuspid, and mitral. And there we're listening for any extra heart sounds, and we are also listening for any murmurs, which none were heard. Then I'm going to move over to palpate the PMI. Alright, PMI is felt. It's approximately 2 centimeters, which is an appropriate finding as long as it's less than 2.5 centimeters. And it's just a brisk tapping, it's not prolonged or anything, which is also another appropriate finding. So then we're done with the heart, test. And we're gonna move on to the abdomen. So, I'm just, inspecting the abdomen, looking for any abnormal vasculature, looking for any edema or ascites, any sort of discoloration, or masses. Gonna use some tangential lighting to look for any type of hernias. Alright, none were noted. I'm going to auscultate the aorta for any bruits. Alright, moving down to the renal arteries, listening for bruits. And then the iliac. And then femoral. Alright, none were heard. So then I move on to auscultation of the 4 quadrants. Okay, lung sounds were active in all 4 quadrants. It was a gurgling hyperresonant sound, which is an appropriate finding. Next, we're going to do percussion. So I'm just gonna percuss, noting the tympany or resonance over the epigastric air bubble where the bladder is, and then noting the dullness in the suprapubic area. Next, I'm going to, on the right side, percuss for the liver. So I'm going to start below the nipple here, right side midclavicular line. Listening for dullness, and then when it's found, you move lower. Okay, dullness is heard. It's approximately 6 to 7 centimeters, which is a normal finding in a female. Then we're going to do the scratch test. I'm going to put my stethoscope here. I'm going to scratch with my finger and listen for the sound to get louder, which would indicate the border of the liver. And then when it got quiet again, that indicates the upper border of the liver. So that was an appropriate finding. It matched what we found for the percussion test. So I'm going to have you roll to your right side here, and we're going to I'm going to go down 5, 6. We're going to go to the 6th intercostal space and percuss down the axillary line to the 10th intercostal space. Okay, tympany was heard throughout. I'm going to have you take a deep breath and let out. Okay, tympany was heard there. Any sort of dullness could indicate an enlarged spleen or splenomegaly. So that's once again an appropriate finding. We'll have you lay on your back. Can you put your legs on just so you can see what we're doing here? So we're done with percussion. We're going to move on to palpation. I'm going to start with light palpation. Just let me know if you have any pain or tenderness. No. Okay, we're gonna do deep palpation. We take a deep breath and then out. Okay, just keep breathing like that. Going 2 to 3 centimeters. Okay, you can breathe normal. I'm gonna feel for your superior and inferior inguinal lymph nodes. Alright, there they are. All of those were small, movable, any pain or tenderness there. Alright, next we're going to do Murphy's sign for cholecystitis. So I want you to take a deep breath in, and when you let out, I'm gonna do deep palpation right below the rib cage or liver. Any pain or tenderness there? Okay. We're gonna test for McBurney's point, so I'm gonna find your umbilicus there, and then your anterior superior iliac spine. I'm gonna go about 1/3 of the way towards the umbilicus, and I'm gonna just press down here. Any pain or tenderness with that? Okay. That would indicate, or could indicate appendicitis. And then finally, we're gonna do, we're gonna do Bromberg's test next, which I'm gonna have you take a deep breath and then exhale, and we're gonna do check for rebound tenderness. Okay, and then we're gonna do some meningeal tests here to test for meningitis. So the first one is Brzezinski's, so you're already in kind of an appropriate spot. So I'm gonna flex your neck. Okay, and then I was just looking for any flexion in the hips or the knees, which would be a positive meningeal sign. And then we're gonna do a Kearney's test, which I'm gonna flex your hip and your knee at 90 degrees, and then I'm just going to extend out your knee. All right. This is a normal finding. An abnormal finding would be if there was any severe pain when you extended the leg out from the hamstring tightness due to the potential meningitis. So that is it for the second portion.